Hey everybody, it's Lori again. I'm here to update the spring shoe list. I usually do the shoe list in February and then I try to update it again in June. Those are the two primary times in the year where the shoes will change. You're going to notice on the shoe list, like for instance, that the Saucony Omni 13 is now the Saucony Omni 14, and I still like it. So when the shoe company comes out with a new shoe for that year, they usually have the numbers go up with that year when the shoe changes. So usually most people notice that the shoe might change color. What we like to make sure is that when a shoe changes, that structurally it's still the same shoe that we'd like it to be. So the Saucony Omni went from a 13 to a 14, is still on the shoe list. The other one, the Saucony, the Brooks Glycerin, went from a 12 to a 13. And the ASICS Foundation is still around. I know that there was a lot of concern. They aren't making it and calling it the Foundation 8. They're going to be calling it the Foundation 12. But structurally, the heel counter, the good arch support that we all like for that reference center for our patients are still going to be there, and the good bend at the toe. So mostly the shoes that are on the shoe list are still remaining intact. That you just might notice that one went from a 12 to a 13, the Foundation went from an 8 to a 12, and that type of thing. There are, however, two shoes that I am taking off of the list. The first one I'm going to talk about is the Saucony Ride. This is the Saucony Ride 7, and this shoe was on the shoe list. You'll notice how it bends at the toe. It has, if you look at the heel counter, I kind of would like to go through the heel counter just to kind of refresh your memory from the video that I did earlier this year. The three basic things that I look for in a shoe is I like a shoe to be able to bend at the toe easily, because that's the normal bend of the foot. I like for the heel counter of the shoe for there not to be a lot of give. We want this heel counter here not to collapse in. And then the second thing that I look for is that when you look at the heel counter, I want you to look at the heel as kind of like being the floor of the shoe. So if this shoe came down and hit the floor, I don't want there to be a lot of give where the heel of my hand is. And I don't think that I've coached this really well, because a lot of people are looking up where the fingers are. I want you guys to look down at this heel, how it's hitting the heel of my hand. And if I press down there, you're going to see that there's not a lot of heel give here. And if I come over here with the 7 and I press down here and this heel hit the floor, that there's not a lot. There's a little bit of give, but not a lot of heel give. So that to me would be okay and adequate. So that's what I look for in a heel counter, and I kind of wanted to explain that a little bit more clearly. Another thing that I like is some of our patients do need a reference with an arch in a shoe. The Ride is more of a neutral shoe. It doesn't have as much of an arch support in it, and that's really why I gravitate more to the ASICS Foundation, because of the great arch support that it has in that shoe. So this shoe, by all intents and purposes, if a patient had a PRI orthotic, or if they had more of a rigid foot, I would like this shoe, and that's why it was on the shoe list last year. However, with the Saucony Ride 8, there's more of a front to back, or for physical therapists, more of a sagittal plane problem. So if you look at this shoe, when I go to bend the toe box, can you guys see how the heel comes up? So our patients aren't going to stay grounded with their heel on the floor. When this toe bends, this heel comes up. So because of that, the Saucony Ride 8 is no longer on the shoe list, because the Saucony Ride 7, when I do that, this heel stays on the ground. So I want you guys to understand that this had a sagittal plane component. When I bent the toe, the heel came up, so it's off the shoe list. So the Saucony Ride 8 is no longer on our approved shoe list for the third time. Okay, the other shoe that came off the shoe list, and I was really questioning this shoe back earlier this year, and I finally decided just to take it off of the shoe list. This is the ASICS GT 2003. If you have a really lightweight individual, like 90 pounds, this may not be as big of a deal, but I'm finding that it's a bigger deal for me in the clinic. And this has more of a frontal plane issue with this shoe. So if we go back to the heel counter that we explained earlier, if you look at my heel, and this is the outside of the shoe, and you look, see how it kind of squishes down. And so what's going to happen is that the track of this patient is they're going to lateralize on the outside of their foot. Remember, when we look at shoes, we want to have a good heel counter so our forefoot can supinate and pronate or go out and come in correctly during the gait cycle. And my concern with this shoe is that there's too much heel give out here that the patient's going to stay on their outside of their foot and not be able to pronate during that mid-stance and toe-off phase of gait adequately to get a good push from their glutes as they run or walk forward. So I decided to take this shoe off the shoe list. You're certainly welcome to look at different shoes. You might look at them a little bit differently than me, but I kind of want to give you guys these updates with the spring of 2015. Have a great summer.